Welcome to Community Health Matters. I'm your host, Amy Marsalis. On today's show, we'll learn about childhood asthma, eating disorders, and cystic fibrosis. All of that coming up next on Community Health Matters. From the News Channel 5 network, this is Community Health Matters, sponsored by the United Health Foundation. Hi, everybody. Asthma in children is a leading cause of visits to the emergency room, hospitalizations, and a lot of missed school days. But if people really get a hold of it and take care of these kids with good treatment and prevention, they can prevent damage to those growing lungs. My first guest, Dr. John Robertson with TriStar, is here to talk about a very, very prevalent illness in our kids. Welcome.
Thank you. Thank you for having me.
Sure thing. Let's talk about how widespread childhood asthma, cases of childhood asthma are in this country.
It's very widespread. It's the #1 chronic disease of childhood. About 1 in 13 children have asthma, depending on the year you quote.
So millions of children in this country.
But a little over 6 million children in this country that have asthma.
Let's talk about what happens in the kids' bodies, in their lungs, and what triggers so many cases of asthma. I know there are various triggers.
Yes, so asthma is a problem of the airways, or the tubes in the lungs that conduct air from the outside world into our bodies. The problem with these tubes is they get inflamed, they get swollen, they produce extra mucus that shouldn't be there, and the muscles that wrap around these air tubes constrict. All of these things sort of conspire to basically shrink these air tubes and make them smaller and therefore harder to breathe. That's what generates the symptoms of coughing and wheezing and chest tightness that are most prevalent.
You just answered my next question about some of the symptoms. When do you typically see these symptoms in kids? I mean, does it start when they're babies or usually a little older?
It can start when they're babies, usually by the age of 5. Most people with asthma have had their first set of symptoms, but it can start at any age.
Is it usually seen in the parents? You see it run in families or not necessarily?
It definitely runs in families. It doesn't have to. There is a group of diseases we call atopic or allergic diseases. This includes hay fever and allergic rhinitis and eczema, as well as food allergies. Sometimes it's another member of this allergic family that runs in the family, whereas the mother may have eczema and the baby or young child develops asthma.
So is that something that as a pediatrician, you know, that you are looking for, if you know that about the parent, one of the parents, that you're looking for that early on?
Yes, absolutely. We want to acquire a family history,
Sure.
and see what else see what other allergic problems are within the family, so that we know what the child is at risk for.
Identify early on. That was one of my questions. So the risk factors, let's talk about what some of the risk factors are. So that if you do have a parent with some issues, that's one of the risk factors?
Absolutely. The risk factors, you can divide them into 2 categories. The risk factors you can control and the ones that you can't. The ones that you can control, the most important is smoking. Don't smoke. When a pregnant mother smokes, or when a child is exposed to smoke in their home environment, even if the parent is smoking outside, it increases their risk of wheezing and the risk of having asthma.
I see a lot of the other risk factors for developing childhood asthma also includes, again, family history of allergies and or asthma, prenatal and postnatal exposure to tobacco smoke, you just alluded to, living in an urban area with increased levels of air pollution as we grow so quickly in Nashville. That's got to be a side effect of the growth, right?
The unintended consequence of progress, yes.
Yes.
So there's the hygiene hypothesis of asthma. There's higher incidence in children born and who grow in urban areas versus the out in the country. There's no one factor. It's just the groups of things you're exposed to in the country versus the groups of things you're exposed to in the city. Some would say we're too clean as far as germs go in the city. But there's increase of irritants and toxins like smog and smoke and ozone.
Let's go back to the symptoms again, too. I know you mentioned wheezing. I believe you said chest tightness is one of the symptoms, too.
Yes, the coughing and wheezing are the most common. There's chest tightness, just feeling of difficulty breathing. Sometimes it's just being tired with exercise. An important thing to note about the symptoms is they're different for every patient. Some patients only cough, some patients only wheeze, but they can both have asthma that responds the same to the asthma controller medication.
All right, and it can be a whistling sound too.
I can imitate it if you like, but the wheezing is like 1,000 faraway whistles. And the cough it's classically a dry cough, but can also be a wet we cough.
So what complications can arise as a result of asthma?
In a child, we think about school absences, and therefore, if your kid's home, you're home. Generally, they don't get, when their asthma is very active, they don't get to be normal, happy kids. They don't get to run and play like everyone else. They start off fine, but after 5 minutes, they're struggling and having to rest or complaining to their parents they're tired. And so a warning sign I usually give to my parents is if you see your child, they can't keep up with their peers and they're 4. We don't have star athletes at 4 years old. Everyone should be basically equal. So if there's a child lagging behind, that we want to look for a medical reason that they're having to rest twice as often as their peers.
And you hate to see that. That's got to affect the kid emotionally, the child emotionally as well, too, if they can't keep up.
Absolutely. One of the measures of how well controlled or how uncontrolled is my asthma is, does the kid get to be a kid?
Sure.
Or does their life look the same or different from their peers? In 2018, the medications we have for asthma are extremely effective. And so when used properly, I would say 95% of the time we can take that child who untreated can't participate normally in kid life, and turn it around and make it basically help them be a normal kid.
Okay, in our last 30 seconds here, ways to help prevent attacks.
Take your medicine. The right medicine used in the right way, given at the right time, will help prevent attacks. There are 2 categories of asthma medicine: quick relief, which the albuterol is the most common one, and the controller medications. People who use their controller medications are less likely to have attacks.
All right. Really solid information as we get back to the school year, too. You said when you tend to see more attacks also because of viruses as the year progresses with school and everything. All right. Thank you so much, Dr. Robertson. Appreciate you coming in and educating us more about childhood asthma. Thank you. And we'll be back with a whole lot more right after this. I'm so excited for my next guest, Courtney Grimes with Renewed, an organization which, if people don't already know about Renewed, they need to know about Renewed. And Courtney here, thank you so much for coming in.
Oh, thanks for having us.
Okay, we're talking about eating disorders, which are so prevalent among young women and men. We can't exclude young guys guys. But I know that you got involved with this, I think, out of a personal experience. Can you share that with us, Courtney?
Sure. I developed an eating disorder in my late teens and was sick for the better part of 7 or 8 years. My weight dropped drastically. Friends and family were worried, but they had no idea what to do. It all sort of came to a head. I was diagnosed with an eating disorder about 90 days before my heart was about to stop.
Was that critical?
It was that critical. And I, as a sufferer of this illness, had no idea what I was doing to my body. I thought I was just being healthy with my eating, healthy with my exercise, but it was a very slow, very elegant form of suicide.
A slow and elegant form.
Very
I've never heard anybody
elegant.
describe it that way.
Yes, anorexia nervosa sadly has been called the most elegant form of suicide as women especially become more and more slender, more and more thin. We receive, especially in American culture, so much positive praise and feedback. Oh, you look so good. Oh, you're so disciplined. And what are you doing? Things like that. So it's motivation to keep going, keep going, keep going.
And so many of the young women we see on Instagram that have huge followings, the fashion, which promotes that kind of body image. Isn't it a psychological, there's a big psychological component to this illness?
Absolutely. Eating disorders are very complex, multi-layered mental illnesses. They affect people psychologically, emotionally, physically, spiritually, socially. Eating disorders tend to take and take and take, and they don't stop until they take your life.
What are some of the symptoms then and the signs? So how did your family know, besides you getting so obviously rail thin?
Sure. For my specific eating disorder, I was able, sadly, to hide it for a long time. And that's what makes noticing symptoms of this illness and others very difficult. We become very protective of our illness, and we want to make sure that nothing and nobody can take it from us. So a lot of times eating disorders involve a lot of very secretive types of behavior, a lot of dishonesty. We will lie, cheat, and steal to cover up what we're doing so that we can keep doing it. Eating disorders are process addictions, so that there's a large addictive piece to this mental illness. Physical signs would be hair loss. A lot of times women will start losing their hair. Nails will become very brittle. Skin will become very yellow and kind of sallow. You can see really sort of dark, wrung out circles under people's eyes. Any type of rapid weight gain, rapid weight loss, that's absolutely a sign that something has happened. Immediate trips, frequent trips to the bathroom. Right after meals and eating, things like that.
Because some people, if they have this disorder, one of the disorders, they're causing themselves to either vomit or taking laxatives, right?
That's
They
right,
abuse.
that's right. For bulimia nervosa, it's defined as a cycle of binging and purging.
Purging, yes.
And what's tricky is something that a lot of people don't know. Purging is not always necessarily induced vomiting. A lot of times purging can be laxative abuse or exercise addiction, things like that. There's different ways to purge, but at the end of the day, bulimia becomes a zero-sum game. Anything that I took into my body, I must expend.
There is a real issue with a distorted body image, right?
Yes, ma'am.
So when you used to look in the mirror, you probably thought you were fat and you were 100 pounds or something.
Absolutely,
Is that part of it?
absolutely. I was literally on death's door and absolutely hated what I saw in the mirror. I couldn't look at it. I was so ashamed of this body. I thought that I was absolutely enormous and I was embarrassed to be in public. And what happens with body dysmorphia is mental illnesses such as eating disorders are due to malnutrition of the brain. So if this organ is not functioning properly, it can't process information properly. It can't do its job properly. Therefore, all the data coming in the senses gets jumbled and distorted and lost. So the visual images you see are not what everybody else sees.
That really paints a clear picture, that description. How did you get help and how can people get help? Let's get to that.
Oh, my best friend called me at work one day and she was crying and she said, I'm really, really worried about you and I've made you a doctor's appointment. And she forced me to go to the hospital.
Made you go.
She made me go. And she said, I know this might make you very angry at me, but I would rather have you alive and angry at me than not have you around at all.
What a friend.
What a friend.
Saved your life.
She sure did.
So at Renewed, what are you doing? What is the organization doing?
Renewed is a beautiful organization. We're the only one like it in the Southeast. It's a nonprofit dedicated to eating disorder referral and supplemental care, meaning that if you Google eating disorders Nashville, we will come up. A lot of calls will come in from really anxious, very scared parents, boyfriends, roommates, spouses, children. something's wrong with my mom, something's wrong with my girlfriend, something's wrong with my sister, and I don't know what it is. And they'll start naming off behaviors that they've noticed. They're skipping meals, and they don't come out with me anymore, and they're very isolative, and they're angry all the time, and I never see her eat. Things like this. I think she might have an eating disorder. I have no idea what that is. I don't even know what to do. This is who you call. You call Renewed. I take these calls. My number one job as clinical director for this organization is to take all of these individuals and find the perfect resources for them, whether it's a psychotherapist, a nutritionist, a program, a sponsor, anything that they need to get well.
So you're talking about it's treating the body and the mind,
Has to
and
be.
probably the soul
Has
too,
to
right?
be,
The
yes,
whole
absolutely.
integrated.
Very holistic.
Wow, you are so impassioned. I mean, I see that, and you've been doing this for a while.
Yes.
Do you feel like working in this space has helped you stay healthy too?
Absolutely. Absolutely.
Is it an ongoing thing?
It is an ongoing thing, and I will say that the more conversations that I have with folks who are struggling, the more I'm reminded of my gratitude for those who helped me.
Gratitude has so much to do with healing, doesn't
Yes.
it?
Yes, it does.
Courtney, thank you. This was so enlightening. I really did not know
Absolutely.
much about the organization, but I went online and I saw the video too, which was
Yes,
fabulous. Thank you
yes.
so much.
Absolutely.
We'll be right back with more after this. Cystic fibrosis is what we're talking about next on the program. It affects 30,000 people in the U.S., 70,000 worldwide. But the good news that our guest is going to share next is that you're making great strides in treatments.
Absolutely.
And you're seeing the life expectancy of patients really increasing. That's the great news. Lee Ellington is the executive director of the Cystic Fibrosis Foundation, the Tennessee chapter. Welcome.
Thank you so much for having me today. I really appreciate the opportunity to come.
We're so glad for you to be here. So let's start off with the good news about how far we've come. I know when I first moved to Nashville 20-some years ago, I was involved in an event raising money for CF, and it seemed like the average life expectancy at that time was maybe in the 20s, late 20s.
That would be about right.
And it's
at
a
that
different
point.
story, a better story today.
It is. It's a much better story today. Our individuals with cystic fibrosis are living into their 30s, 40s, and beyond. You know, they are having the opportunity to get married and start families, or even have careers. And so we are very excited for the progress that's being made.
All right, let's go back a few steps then and start with what really cystic fibrosis, what it involves in a person's body, and what happens to a patient when they develop CF.
Sure, absolutely. So cystic fibrosis is a genetic disease, and it follows a recessive gene. So a mother and a father must both be a carrier of that gene. And if a baby is to inherit both copies of the gene that has cystic fibrosis, which for every time they would have a child, there'd be a 1 in 4 chance that that could happen, then an individual has cystic fibrosis. Some of the early signs could be intestinal issues for infants. It may be failure to thrive. They're just simply not able to gain weight and keep the nutrition that they need to grow. There are also a lot of respiratory issues with cystic fibrosis. So it's predominantly a respiratory and a digestive disease. However, really many other organs, including sinuses, reproductive systems, are also affected by the disease.
Okay, so does it typically manifest itself or show up in newborns? I mean, do you see the symptoms right away?
Not always.
Not always.
Sometimes there are symptoms that are pretty evident. Maybe it's an intestinal blockage upon birth or something like that. However, cystic fibrosis is part of the newborn screening process. So majority of our cases are able to be diagnosed right at birth thanks to that process. Beginning in 2010, all 50 states include screening for the most common types of cystic fibrosis as part of their newborn screening process. So most cases are diagnosed by age 2.
So the testing that they do, what is involved in that testing? Is that a traumatic thing for the infant, or?
Newborn
things?
screening is pretty easy.
Pretty easy.
It's just a part of the general panel that they do. Should there be cause to look further into cystic fibrosis, they may do what's called a sweat test, which is really kind of the gold standard for diagnosing cystic fibrosis. It is really what confirms diagnosis most of the time. And that's simply testing the salt level in a baby's sweat. And if it registers over a certain level, then that is a case of cystic fibrosis.
I know when I had done some stories in the past on cystic fibrosis patients, I saw treatment where they would sort of, I hate to say pound on the
Yes,
patient's
percuss.
chest, percuss is the proper term. Describe what happens during some of those treatments, and is that what they're still doing?
So airway clearance is extremely crucial. What happens in an individual with cystic fibrosis is this thick, sticky mucus builds up on their lungs and many organs in the body. And so what we have to do is get that mucus out. And so airway clearance techniques can take a lot of different varieties. There is the manual percussion, which particularly with our babies you see a lot. They may lay an infant over their lap and kind of manually percuss in different parts of their chest and their back.
Yes.
We also have more
They're like vests
equipment,
or
yes,
yes, I've
which
seen
makes
those.
it a bit easier. It's looks like a life preserver vest, and it sort of blows up like an air pressure cuff does, and you can connect some compressor hosing to it, and it will pulse air into that vest and help shake up the lungs and allow an individual to cough up that mucus that is in their lungs more easily.
Is it typically you have to do some of this every day for most patients? That's just part of their lives and
Yes,
treatment.
absolutely. Caring for someone with cystic fibrosis takes quite a bit of treatment. Typically 2 hours a day for 30 minutes at a time, they're going to do that airway clearance. They also could take anywhere from 14 to maybe 16 different medications. There could be some nebulized medications while they're doing their airway clearance, saline rinses, enzymes to help them digest their food upon every snack and every meal that they eat. It is quite extensive, the daily regimen, just to keep someone with cystic fibrosis healthy, not to mention the increase in that routine that may need to happen should they be sick.
Oh wow, so there's a lot of discipline involved if you're
Absolutely.
a patient or part of that patient's family.
Absolutely. It requires a lifestyle to really care for them. But I will say I'm constantly amazed by those with cystic fibrosis because often it's routine, it is normal. They don't see it at the level that we do. I couldn't imagine having to stop my day twice for an hour at a time to do all of that treatment day in and day out. There is no rest on that.
How does your foundation, how does the Cystic Fibrosis Foundation assist these patients and their families? What kind of support do you provide?
Yeah. So the Cystic Fibrosis Foundation is really, we try to help on multiple levels. One of the first that we realized back in the 50s when the foundation was formed that many people didn't know about cystic fibrosis, including our own medical community. And so educating physicians on what cystic fibrosis was, which then led to the accreditation of our care center network. So there is a pediatric care center and an adult cystic fibrosis care center here at Vanderbilt, to which CF patients can receive the specialized care, including multidisciplinary assistance. So we help fund a portion of those and accredit them. We also are the main drivers in CF research. And so we are working with pharmaceutical partners as well as universities in that research and progressing the symptomatic treatment, but also aiming towards the cure. And some of our latest medications are actually attacking cystic fibrosis at the cellular level, and with the goal of correcting the defect, which can then help them live a more normal life.
Okay, thank you so much. Thank you for watching Community Health Matters.